So what I hope we will see is a structured reworking of the way in which we look at our children and we prevent obesity taking place in the first place. That's what it's all about. It's trying our best to stop our children becoming fat. And it may mean a lot of work, but it will be worth it in the end, and that is what the Obama plan is saying. Of course, in order to do that, we have to have the staff. The Obama plan has no problem about the staff. The staff are there. They're just going to make sure that the staff are structured to do this prevention. In this country, however, we have a dearth of staff. We have too few midwives. We have too few health visitors. We have too few school nurses. And we have a paucity of dietitians. We must do something about that to make this work. And I hope that the coalition government will address that very quickly. It is with great regret that I read the Conservative manifesto, the draft one, which says we will have 4,000 new health visitors in order to make things work, in order that we should have breastfeeding up to its proper rate. Then it disappeared. It may have disappeared simply because some typist forgot to write it into the final document, but my fear is that it's disappearing because of the current economic situation. Keynes will have told you that during a recession, it is not sufficient to sit back and say, oh my God, we have a recession, we can't do anything. What you need to do is you need to spend your way out of it. And what the government should be doing is to bringing back into the system all those people who left the NHS during the last 15 years because they got better jobs outside, who are now potentially unemployed, and start to bring it back. The Obama document spends a lot of time talking about breastfeeding. Breastfeeding is the best way of getting a woman into, getting a child into shape, and has great effects on the woman as well. She bemoans the fact that in the United States, only 25% of mothers are still breastfeeding at 1 year. She would be horrified to know that in this country, only 1% of mothers are still breastfeeding at the end of the recommended 6 months nutrition. We have to get breastfeeding back onto the mainstream, and that can't be done by glossy leaflets and circulars and videos and this and that. It's got to be done by person-to-person contact, and the person-to-person contact is the support workers and the midwives, then followed through by the health visitors, and that is something which has got to be put in place, and very fast. I'm not going to be talking at all about the recreation because that is something which I will leave to Mr. Sandhurst when he comes. But I will also just mention briefly school food. School food in America was in as disastrous shape as in this country until Mr. Jamie Oliver came along. And that is one thing that we can teach the Americans, and they can really learn for us. And Jamie Oliver has been, as you know, to the United States, and he is starting to turn the US system upside down too. That is what Michelle Obama is latching onto and ensuring that all Americans now, all American children, have good food at school, but not just at school, throughout their schoolhood, throughout their childhood, in restaurants, in takeaway areas and whatever. Even spreading to the park system, where the whole continuity of good food has to be kept on. And certainly this is something which should be happening into this country. In terms of sport and recreation, the biggest headline from the Obama document is that the 60 hours of physical activity per day will be a must. And since, Mr. Chairman, you brought in the prospect of breaks, or as it is called in America, recess, is going to be a fundamental part of their school working day. It will not just be the once and for all PE class that children go to. They will have structured recess throughout the day in order to move around between lessons And also the whole concept of sport will be integrated actually into the lesson plan. School dinners in America will become as much a part of the education process as it is an eating process. And therefore the theme of healthy living will actually pervade the whole of the American school day. Finally, the war of the obesity will end with the kind of commitment which I think that Michelle will bring to it, and that is the charisma which she has. And unfortunately, we do not have it in this country. However committed your workaday politicians are, they will never have the time, or indeed maybe not even the inclination, to go out there and pummel the streets. We had Jamie Oliver. He can't quite clearly be the czar because we wouldn't pay him enough. But we have nobody else. And until we do, then I think that maybe our obesity campaign will flounder because it needs that real drive and energy to make things succeed. Now, Michelle Obama knows that her time in the White House is limited, and I'm not giving a game away. She can only be there for a maximum of 7 years now. But what I think she will do is to continue it, and she will see it through to the end. And I think that she's got a real good chance because she's getting friends as she goes along the line. You heard of a guy called Bill Clinton. He used to be president, but that was now 8, 9 years ago. But he is still as influential in America because of his commitment to childhood obesity. So she signed up Bill Clinton, and therefore there is a real drive going on there. Now, I don't know personally Ann Milton, and I have no idea what kind of style she's going to give to the whole thing. But my suggestion is that we look very fast for somebody who will take on obesity and make it happen in this country, because that is what is needed. Mr. Chairman, thank you very much indeed.